Welcome to the first segment of our learning series on team-based care basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. This first segment will provide an overview of the basic concepts of team-based care and introduce the tools and methodologies we will include in this series. Here is a list of all the segments included in this program. You can watch them in order for a full overview of this topic or access individual segments that focus on your immediate needs. The learning objectives for this series include providing an overview of what team-based care is, why it is important, and ideas for how to design and implement team-based care to meet the needs of our patients and practice. We will provide strategies to help build care team capacity and resilience, and share ideas to expand and sustain team-based care in our practice and beyond the clinic and into the community. There are many excellent resources already available on team-based care, and we will reference these materials as we move through this series. The links to all these resources will be available in the final segment. Our intent is to complement these existing resources and focus more on the steps and tools to help support the organizational change that comes with implementing team-based care and how to prepare our staff for these changes. The Institute of Medicine defines healthcare teams as two or more healthcare professionals who work collaboratively with their patients to accomplish shared goals. A team-based model of care can strategically distribute and share responsibilities that support the patient and their care across the team. In team-based care, roles are expanded and all staff work at the top of their license, experience, and skill set. It means establishing protocols, workflows, and documentation to support the team and help team members work independently. And it is engaging the best of each team member to help create a patient-centered experience. A team-based care model for delivering services can help support the quadruple aim: improving population health, enhancing the patient experience, reducing cost of care, and improving provider satisfaction. The goals for team-based care can include improve health outcomes and health equity, better access to care for our patients, and improved patient experience, improve support for patients with complex conditions, and improving overall population health. It can help expand healthcare team capacity, knowledge, and resilience, and help to create a culture of quality, teamwork, and flexibility within our practice. Structured care teams can be used effectively to perform key primary care functions that might sometimes get missed or deprioritized under the stress of busy workloads, staffing changes, or staffing shortages. Each team may look different, depending on the needs of the patient population and practice. Here are some potential team members that may be included in the delivery of team-based care services. Teams may also include these other practice-specific team members. In later segments of this series, we will review how to establish a care team to fit our needs and the specific roles they might play. And don't forget, the patient is the most important member of our team. With team-based care, our patient will encounter a united team who is working collaboratively to help meet their healthcare needs. Throughout this learning series, we will use these guiding principles to help design and deliver team-based care services. Along with these key elements, both of which are covered in more detail in the next segment of this learning series. The Institute of Medicine identifies these principles that embody teamness and are critical to high-functioning teams. We will encourage the use of these guiding principles to help build teamwork, strong relationships between team members, and a solid team culture for the practice. This learning series is based on these 8 steps to build team-based care. As we move through this learning series, the individual segments will focus on the details of each of these steps. Team-based care models take many forms. Whether formal or informal, big or small, we should start with where we are and expect our plan to change as we learn and test out ideas. We encourage the use of the materials and recommendations in this learning series to design, implement, and sustain a team-based care model that will meet the needs of our patients, practice, and community. We will also discuss the many tools that can be used to help manage and support our team-based care journey. In the next segment, we will review terms and definitions, along with the team-based care core concepts that are included in this learning series. Thank you for joining us.